Hello, everyone. It feels like I've entered a family here. This is my first time joining this call, but I have been part of the community for a bit longer. So I recognize some names and just appreciate Courtney for the work that she and her team have done to bring everyone together. So my name's Leslie Ann. I'm British, living in Washington, DC. So a lot happening in this neck of the woods at the moment in many ways. But what I'd like to do in just a short time with you all today is share 4 initiatives that I have really good fortune to be involved in with some incredible partners. And I feel I'm speaking and I'm here on their behalf as well. It's definitely not just about work that I'm doing. So what I'm going to do in this short presentation is just take you a little bit on the journey that I've been on since the 14th of March. So if you could do the next slide, Courtney. Thank you. Could be quite a long journey, everybody.
Is that working?
If you could kind of keep it moving. Cool. Okay, you can just about see. So I'm going to talk about 4 initiatives I'm involved in. I'll say a little bit about 3 and 4 now, but primarily I'm going to focus on the first one and show how that feeds into the second initiative. So I'm just going to start with numbers 3 and 4. The virtual marketplace is an incredible initiative that's being put together with Core Group, who I'm doing some work with, and Needs List. Needs List works in the humanitarian space, and essentially they've created a platform that's been adapted for COVID response, where countries are able to post on the platform, a little bit as if it was eBay, the needs that they have in terms of PPE, other medical supplies and essential equipment. Donors and suppliers can then come to that platform, look at what's needed by which country, and then they can offer either funding or other support or supplies at cost or pro bono, so that they're matching both the demand and the supply in a way that meets needs directly on the ground. And what's so interesting in the 7 countries that Core Group and Needs List will be working in is they've engaged very closely with the Ministries of Health and also with transportation organisations. So as soon as those demands have been met by supplies, they're able very quickly to move to be able to get those materials and equipment to people where they need them. And so the virtual marketplace does 2 things. It surfaces those needs, but it also helps aggregate demand so it can keep costs down. So we're thinking of it as a sort of virtual, as I said, eBay for COVID. And if there are any participants here on the call today that are interested to know more about that, drop me an email and then I can put you in touch with my colleague at Core Group who can tell you more about it.
That's fantastic. And Leslie Ann, do you mind if we share your email with the community?
Oh, that's fine.
Okay, fantastic.
Yeah, please do.
Yeah, okay.
The COVID-19 Vaccine Literacy Initiative, this is incredible. It's really a 12 to 18 month initiative led by Wilton Park and the University of New York and the London School of Hygiene and Tropical Medicine. And what we're trying to do is bring together, and we have our second meeting on Monday, we're bringing together academics, health experts, scientists, global institutions like Gavi, CEPI, WHO, and then some of the really big donors. And we're also bringing together behave change experts and social media experts to think about how do we create a global awareness campaign for when there is a candidate for vaccine against COVID or more than one vaccine. So we're very focused on creating a vaccine literate global community. But also at the same time, we're very cognizant of needing to keep routine immunization services going. And we've seen a real downturn in those, particularly in low-income countries, for a number of reasons, including that a lot of facilities are closed. And so people are not able to access immunization for their children. So we're approaching this from a campaign approach, dealing with misinformation and disinformation. And it's really been inspiring working with so many people who are focused around a global initiative that has such a local context. And so we're trying to really understand the nuance of working in very different settings where COVID is being dealt with, received, thought about, reacted to in very different ways. So that initiative will continue over the course of the next 12 months. And we'll be reaching out to people periodically to invite engagement with that through the different work streams that we're currently developing, which includes communications, vaccine preparedness, vaccine distribution, private sector engagement, and others. So I'll certainly be able to post updates into this community about how that dialogue is unfolding and what we're looking for.
Yeah, that is amazing, because it is so true that how anything like this is experienced is so different community by community. And so the fact, and behavior change and all of the communications work you're doing, that's really amazing, because it is different how it's seen, stigmatized, how it's experienced. So
yeah, absolutely, Courtney. And I think one of the challenges will be, even if we're able to raise the level of awareness required, it's getting vaccines to vulnerable communities or communities. That last mile can be very intractable. I'm working with an organization called MacroEyes, which work with AI and predictive analytics to try and understand population movement and where there are populations more likely to be open to uptake of the vaccine, so that it can be done in the most cost-effective and efficient way.
fascinating. Okay. Do you want me to move?
Next slide.
Can you see this? Is this working?
Yes. So 14th of March was a Saturday, and I've been thinking a lot about COVID response, and I'd just come back from the UK to the US, and I realized that I wasn't going to be going back there anytime soon, and my 3 sons live there, so I was kind of feeling it a bit personally. And I thought back to some work that I did during the response to the Ebola crisis 6 years ago in West Africa. And what you can see there is a little sketch that I came up with, thinking about who are the people that I know that create great content, that are excellent at convening and collaborating, and that are getting content to frontline health workers in multiple countries. And so I came up with this sketch, and I took it to my colleague, who's the executive director of the Community Health Academy. And I said, Magnus, I've got this idea. I know it can work. Let's do it together. And he was like, great, how much funding have you got? I was like, actually, there's no funding. He was like, what the hell, we'll do it anyway. And so we pulled together 5 partners, and I'll put their logos up later on in the presentation. Mm-hmm. Essentially, we worked together for about a month before we were able to unlock any funding. And what was so inspiring was bringing together experts in health, communication, in training, in language, in convening, in delivering healthcare at the last mile, that were willing to come together, set their egos aside, and really collaborate on an effort that, when I've done something similar in the past, took about 9+ months to bring from idea to fruition. And this took us 10 weeks. So everyone was completely exhausted by the time we launched. And if we go to the next slide, you'll see how we went from this drawing to an actual product. So the COVID-19 Digital Classroom and Library. So we launched on the 1st of June. Essentially, this is an online platform and library of open content, open resource materials that have been curated from existing content and gone through a quality assurance process. We also had funding that we were able to commission 3 new animations and 3 courses that focus on an audience of community-based health workers. They may be volunteers, community health workers, frontline nurses and midwives, and so on. So we launched this on the 1st of June. And the next slide will just give you an illustration of some of the animation screenshots. So the animations are around what is COVID. The second animation is on how to prevent COVID. And the third one is on mental and health and well-being. And each animation is around about 1.5 to 2 minutes long. We have a Kenyan animator and a Kenyan woman doing the voiceover. And the idea of using animation is that it's incredibly simple to understand. Even if the voiceover is in a language that you don't speak, the actual animations themselves are very clear. And creating content in animation means it's quite easy to adapt it, although we've tried to take a sort of global approach with this. currently the animations are available in English, French, and Swahili. And we're currently having them translated into Arabic, Spanish, and Hindi. Next slide. So we also created a series of 3 courses, and the animations are integrated into these. Same audience, community-based health workers. The courses take about 45 minutes to do online. We're currently in the process of adapting them so they're mobile responsive as well. And they're a mixture of animation, video, text, quizzes, and questionnaires. So we've tried to make them as interactive and as engaging as possible. And they follow the same theme as the animation in what is COVID, prevention and protection, and mental health and well-being. Next slide. So just to summarize what I was just saying about the classroom and the library, these are open source multimedia resources. They are designed to be relevant to frontline and community-based health workers. We did a content mapping supported by Core Group and their partners on what content already exists. And I'm sure most of you are aware there is a massive amount of information out there. And much of it is really designed for people working in high resource settings. And we found that the gap was really in that very frontline area in low resource settings where there was very little content that was relevant to the resources that they work with. So that's what drove the decision for the kinds of animation and courses that we created. When you go into the library, you can search by the subject matter. So you might want to put in hand washing, or you might want to put in prevention, COVID prevention, but you can also search by audience, which might be general public, doctor, nurse, health worker, and so on. And as we build out the library, you'll be able to search by country and language, and you'll be able to search by video or PDF or poster or course. So we're trying to make the platform as intuitive as possible. And we develop content or create content in 2 ways. One is our own process that we get funding for, and the other is we invite content developers to submit their materials. They're able to upload them online. We have criteria to help them understand whether or not their content's likely to be a good fit. There's then an automatic process that sends those materials to a team of reviewers that includes medical review for accuracy and being up to date, pedagogy experts, training experts, and health workers working in low-income settings, so that we really can ensure that the content in the library is relevant to the people that we want to serve. So the idea of this library is to bring together in one space this easily searchable, free, downloadable content that can be used on mobile devices offline. Once it's downloaded, you can view it offline, share it using Bluetooth. That means that health workers can have in their hands the information that they need to raise awareness in their community, and we hope to be able to help save lives. Next slide.
Sorry, I was just getting like, I was getting so excited. It's amazing.
So these are the 5 partners who are willing to go with the vision, work for no money for the first month, believe that the process would work, and that we would be, we'd be able to unlock some capital in the end. And so the Digital Classroom is the name of the consortium. It's led by the Community Health Academy. Tech Change do the courses, Medical Aid Films do the animations, translators do the translation, and Core Group is our key communications and convening partner. Courtney, you mentioned at the start, UNICEF is also a partner. They've just come on board, and we're finalizing the MOU with them at the moment. What's so great about that is their country offices are calling for more training materials, and they work closely with ministries of health. And that's a distinguishing feature, because if we don't work closely with ministries, it's very hard to get the content to health workers. So we have formal partnerships with the ministries of health in Ethiopia, Liberia, Sierra Leone, and soon to be Uganda. And now through UNICEF, we'll be able to ensure that that content is used by ministries from other countries as well.
Amazing.
And last slide is, what can I do? What can you do? And here are 4 ways that you could be involved. And just while you're looking at that, just to say, with the Youth Responders Initiative, I my husband posted an article on LinkedIn. He works in countering violent extremism, and we were talking in the article about how COVID-19 provides air cover for extremist groups to recruit young people with promises of, important roles, food, water, recognition. And so one of the things we wanted to think about is how could we build on work that youth are already doing in their communities to give them a really featured role in providing greater awareness in their community and working alongside the frontline health workers as almost first line responders themselves. So I put a small piece about it on LinkedIn, and Save the Children reached out and said, we're interested, how can we help? And then Search for Common Ground also were really interested. So they have come together as the two lead partners for an international youth responders initiative.
Which is
great because
amazing.
exactly, we're adapting an existing model. So the thinking, if you like, is being adapted and expanded. So we're still looking for some funding to get that off the ground, but we're creating a youth advisory team. Search will be helping us set that up with young people from Sub-Saharan Africa, Middle East, South Asia, Latin America. And the idea is to adapt existing content, but also create new content, and for youth to be able to then access that via mobile devices. And our aim is to reach 10 million youth this year and 100 million youth by the end of next year, and then go on to use that model to be able to share content that's around education or leadership. This is not just about COVID, this is also about long-term health system strengthening, but also for young people, providing them with other learning opportunities. So I'll end there because that's a lot of information. I think it's your flavor of what we're doing.
Are you? Like, you are amazing, and the work that you're doing is amazing. And I know we're at our time, 2 o'clock. Do you have access to the chat? Can you type in your email address?
Of course.
Thank you. And then we'll have that recorded, but we'll also share that and your website and everything you do. We'll share that with the community. Does anybody have any last comments that you want to say? But Leslie, thank you. I mean, amazing stuff that you're doing, and so impressive and so fast. Yeah, like you said, what you used to do in a couple of months or years, you did in a few weeks. So thank you.
All about the partnerships and the collaboration, Courtney. It's just a real shout out for me to the incredible people that I'm working with.